Hey guys, Luis Moreno with Simply Health again, and I've got Nick Micheletti from Heartland National Life, and he's going to be talking to us about Medicare and the hospital indemnity. Why do we want to pair this product when we're dealing with seniors and Medicare? So Nick, I'm going to let you take right over, man.
Thank you, Luis. Appreciate everybody's time today. Our conversation is really going to be about Medicare globally and where the hospital indemnity product fits. I want to first and foremost talk about why you should sell the product, but then again, show you where in the market that it actually fits. We'll talk about the value, then we'll take a deep dive into the benefits, and then give you some pointers on how potentially you can present this product when you're out there on a Medicare Advantage appointment. So again, Nick Micheletti, Director of Operations with Heartland National Life. I was very instrumental in building this product. But for you as agents, why should you add hospital indemnity to your product portfolio? Well, and it kind of touches on things that we've talked about in previous trainings, is that we're all educators here in our industry and what we do. So when we're sitting down and enrolling a client into, let's just say, a Medicare Advantage plan, for instance, a lot of times those plans are going to be $0 premium plans. And then what's the trade-off with the $0 premium? There's out-of-pocket expenses that the client will have to be responsible for all the way up until a maximum out of pocket. So a $0 premium sounds great until your client's hospitalized for 5 days at a $300 per day copay and they get a bill in the mail for $1,500. So again, we're educators, we're showing them what they're getting enrolled into, but then also providing a solution to help protect them from that $1,500 bill that may come down the road when the event something happens to them. So we're going to present them with another solution to help give them more well-rounded coverage and add to their Medicare Advantage plan. So by doing that, as being an educator, in turn, it's going to give us the opportunity to earn new income throughout the year. You know, this product can be sold all year long. You do not have to be AHIP certified to sell this product. And we actually pay commissions as soon as we process and issue the policy. So we've got a lot of agents out there writing plans on Monday or Tuesday using our e-application, and they're seeing deposits in their bank account on Thursday or Friday of that same week, which as an agent myself, I know that's incredibly important, especially during AEP while we're out running and gunning and getting everyone enrolled into these Medicare Advantage plans and not seeing the commissions on those until after the effective date. So another great way to subsidize that income during AEP is by adding hospital indemnity plans. So it's providing your client with more well-rounded coverage, giving you the ability to earn new income. You guys will find that this product's incredibly affordable. You know, when you just have the base plan and the ambulance rider, it's going to be in the low $30 monthly premium. So we're not getting anywhere near what the cost of a Plan G on the Medicare supplement side would be, or even a Plan N on the Medicare supplement side. So with that $0 premium, we're adding a $30 to $35 hospital indemnity plan and giving that client some peace of mind with some very valuable coverage there. It's a simplified issue product. So as long as your client answers no to the health questions, we're going to process and issue that policy and get you paid. So know that it's a very easy process in order to write the application. We do have a guaranteed issue period between 64.5 and 65.5 that your clients can take advantage of as well. And that's available for the base plan and all of the riders outside of the lump sum cancer rider. That rider will always require the 2 health questions be asked for the lump sum cancer rider. We've talked about this in the past, but it's going to help increase your persistency. Not only are you adding more policies in the home, but take this example, for instance. You've got a client enrolled into a Medicare Advantage plan, but you didn't take the time to at least offer the hospital indemnity plan. You've got another agent that knocks on that door several months down the road, and they ask your client for their hospital card. And your client says, you know, I don't have a hospital card. What are you talking about? Well, your agent then pulls out our hospital indemnity plan or another one in the market and reviews the product with your client. And they say, well, you know what? That makes all the sense in the world. I'd love to take this product with you. So they add that plan, and you can guarantee it at the end of the day, they're going to be coming back around and trying to take that Medicare Advantage plan, that agent of record plan on that MAPD plan from you as well. So make sure we're offering it, and then let that client make the decision whether to decline the coverage or to take it out. So certainly going to help increase your persistency. And then lastly, what I'll touch on is just the MAPD market it's growing, it's booming, it's expanding. We'll touch on a couple of slides that just talk about, you know, what the opportunity looks like in that market. And with that opportunity is going to come the opportunity to offer these companion type of products to help fill those gaps there. So let's take a look at the Medicare market, very big picture. You know, I try to keep things really simple, And a lot of people can say Medicare can be confusing. Well, this slide in front of you shows you that that's not the case by any means. When it comes to your options for your clients who are aging into Medicare, there's really three most common options. You can see on the left-hand side is your just original Medicare, Part A, adding your Part B coverage and adding a prescription drug plan. Now, most of us here know that this is not very secure coverage for your client. Your client's going to be responsible for the $1,484 Part A deductible that they'll be responsible for every 60 days. They're also responsible for the 80-20 coinsurance percentage that's passed on to the Medicare beneficiary. So, for instance, if your client had a $100,000 Part B bill, they're going to be responsible for 20% of that, or $20,000. And you may be saying, well, what's the max out of that? What's the maximum out of pocket on original Medicare? There is no maximum out of pocket with original Medicare. So that's why we as agents oftentimes are going to present the option in the middle or the option on the right. So again, no maximum out of pocket with original Medicare. So I would not feel confident leaving my client with just A and B coverage. And that's why we add either the Medicare supplement plan, which you can see in the middle here, which supplements original Medicare and fills those gaps. It's going to take care of that $1,484 Part A deductible. It's going to take care of that 20% coinsurance risk that your client has with Part B. It's going to fill those gaps. Now, the thing about Medicare supplement plans is it comes with a monthly premium. And typically a plan G is going to start in the low $90 and go up from there. And a plan N is going to be in the $70 range and start up from there. So unfortunately, affordability, if it's a problem, a Medicare supplement plan just may not be an option for your client. So that's where a Medicare Advantage plan, Part C of Medicare, comes into play. What Part C is going to do, it's going to consolidate all of original Medicare's benefits, include everything that Part A does, Part B does. More often than not, it's going to include your prescription drug benefits. And then we're seeing all these extra benefits added to it this day and age as well. I mean, it's pretty much standard to have dental, vision, and hearing coverage with the Medicare Advantage plan, transportation benefits, gym memberships. I mean, I've been going out to AEP events this year and I'm seeing crazy things out there.
Hey, let me tell you about crazy. They're doing pest control.
Yep.
They're also doing a dollar amount for home improvements. For example, if they want to add a rail to their shower. And there's even one carrier who is adding, and I don't know if it's coming to Texas yet. We were in California and they were breaking this news out where they can get a quarter. What's a quarter? 90 something days. I was like, wow, I got to do math in my head. We had 90 days of meals delivered. They deliver them once a week. And this is just they call it an EE, an extra, essential extra, whatever it is. But anyway, it's on top of all the other benefits. They get to choose one more extra. So these extra benefits are crazy.
And part of the reason why these plans are growing in popularity, I mean, the benefits are getting richer, the networks are getting stronger, and you're seeing these extra benefits that are almost, it's almost unheard of what you're seeing. I mean, we're seeing healthy foods card where you can actually get a certain dollar amount on a debit card and go swipe it at the grocery store. And the craziest thing I saw recently was a robotic companion dog at a recent AEP event. I believe it was a WellCare product. They're giving a companion robotic dog that barks and runs around the room. It's crazy, unlike anything I've ever seen. So that's why these plans are getting incredibly popular, because these benefits are really, really rich. So you may even have clients who can afford a MedSup, but they're happy with the network of a Medicare Advantage plan and the benefits they offer and would rather take the premium and put it into a savings account in case something happened to them down the road. So really, overall, there's just not a one size fits all approach to Medicare. And I'll show you a slide that gives you two different perspectives on that here in just a minute. Okay. But talking MedSup, MedSup is near and dear to my heart and kind of my bread and butter. People also think that MedSups can be complicated. Well, I'm here to tell you it's not. The only plans that you really need to know about are F, G, and N at the moment. Those are the most common plans. And Plan F used to be the Cadillac plan. You can see on my screen here all the different out-of-pocket gaps that come with original Medicare. If you look at an F, it's covering 100, all the way down the list, 100% of all the costs that original Medicare does not cover, and then offers some foreign travel emergency benefits as well. So F used to be the Cadillac plan. It is no longer available to new beneficiaries that became eligible after 1/1/2020. And why is that? The government wanted consumers to have more skin in the game. So you can see the difference between an F and a G here, which again is now the most common option, is only the Part B deductible of $203 is what it is today. The government wanted consumers to have more skin in the game, so they had to be responsible for the first $203 before their plan kicked in. That way, they weren't going to the emergency room with a sore throat or a cold. They wanted the consumers to be a little bit more conscious, and that's why they got rid of F and C, which covers the Part B deductible. And now Plan G is the most common option available, or most common option being taken by most of the consumers out there. Covers everything that F did outside of that Part B deductible there. And another plan I feel that's starting to take market share is Plan N as well, because it comes in at probably about a $20 less monthly premium than a G. And really, there's not a whole lot of exposure there. Excess charges is one but it's not something that we see out in the market that's incredibly common. So I think N is a great option as well. And, maybe we'll hop on another training here down the road and we can really take a deep dive into the Medicare supplement options, but you really just need to know F, G, and N at this point. And a good example of showing how that works here is, talking about those gaps in original Medicare on the second half of my slide there. You can see those gaps we talked about: the Part A deductible, co-insurance, the skilled nursing, Part B 20%. If you have a Plan G, yes, you're paying a monthly premium for that, but your cost with that Plan G, you can see across the board, is $0. So paying a monthly premium to know that you're not really coming out of pocket with anything.
It's a good way to figure out what you're set your budget. You know what your out-of-pocket costs are going to be for the entire year. Exactly.
And some people like that. They like that fixed dollar amount per month that they know that they're going to pay in case something happens. So again, it's not a one-size-fits-all approach. Consumers have different perspectives on how they want to budget for their healthcare and what their risk tolerance is and so forth. But today's conversation really is revolving around the hospital indemnity plan. So while, the Medicare Advantage plans a lot of times are $0 premium and the trade-off is there's out-of-pocket expenses, now we've got the ability to cover that client from those out-of-pocket expenses with the Medicare Advantage plan by using a hospital indemnity plan at 1/4, 1/5 the cost of what a Medicare supplement plan might cost. So if you were wondering where this product fits, it fits like a glove around the gaps of Medicare Advantage plans. And again, we talked about those two different mindsets of consumers. When I'm in front of an audience, I like to bring this slide up and then kind of quiz the audience and say, the lady on the top, she's willing to pay higher premiums and trade for lower out-of-pocket cost and nationwide provider choice that comes with original Medicare. So what would she be most of an ideal candidate for? Well, she's willing to pay a premium and she doesn't really want to deal with a network. She wants her nationwide provider access that comes with original Medicare.
That's straight up MedSup.
A MedSup client, ideal candidate for a MedSup. Now, the gentleman below, just a different perspective. He prefers to save money on his premiums and doesn't mind out-of-pocket exposure and a limited provider network. Medicare Advantage consumer right there.
Correct.
So again, it's not a one-size-fits-all approach. It's definitely on the mindset of that consumer. But when they do choose to go down the Medicare Advantage plan route, we do want to be cognizant of those out-of-pocket costs and help protect our clients. So a lot of times on my appointments, I hear agents tell me, I should be selling the hospital indemnity plan. I know I can earn more commission. I know it's going to better serve my client, but no one's just taken that concept and shown me how to do it. And I know you're going to do it here in a bit, so I won't spend a whole lot of time on these slides. But what I want to just present is, what is the thought process when building a HIP plan around a Medicare Advantage plan? What I would advise you to do is review the summary of benefits and first and foremost, identify what the hospital copay is. Typically, that's going to be one of the most expensive parts of a Medicare Advantage plan. How much are you responsible for as your copay and for how many days? So let's identify that. Let's also identify the maximum out of pocket. And then let's pull up the quoting tool and start to quote our products. So $0 premium Medicare Advantage plan, you can see in front of me right here. Third line item down, inpatient hospital copay, $340 per day for days 1 through 5. And you can see all the other list of out-of-pocket expenses: skilled nursing, outpatient surgery, ambulance, emergency room. Annual maximum out-of-pocket on this plan is $4,500. But if you add all of these up, in the event of an accident or illness, your client takes the ambulance to the emergency room and is hospitalized for 5 days, they could be potentially responsible for over $2,000 in out-of-pocket costs. So again, $0 premium sounds great, but let's just make sure clients know that they're responsible for these costs and give them a solution to help protect them from that. And the solution is by packaging Heartland National Secure Advantage Flex Hospital Indemnity Plan. So what we're going to do here is build our product at $350 per day to cover that $340 copay for 5 days to cover that copay duration. The ER benefits built into our base plan, and all we're going to do is add the ambulance rider at $200 per trip. You build this product right here, in the event of that accident or illness, the benefit paid to your policyholders, $2,100. So while they may only be responsible for 2015, we're paying them $2,100. It's an indemnity plan, so we're going to pay them exactly what they've enrolled into, and they can do whatever they want with that additional $85 because there is no coordination of benefits. And then you may be saying, well, how much does it cost? Well, you can see right here, incredibly affordable for a 65-year-old. When you include the household discount, it's only $31.53. So a ton of value. And that's what I want to talk about in these next slides here. So now your client's been paid $2,100 worth of benefit. Divide that by your monthly premium of $31.53, and it's going to give you a 66.60, which represents a monthly amount. But essentially, what this is saying is with this one benefit payment here, it would take your client over 5.5 years to pay more in premium than he or she would receive in benefit from this one occurrence. Now, Luis knows our plan restores every 60 days. 61 days later, they're on the ladder, cleaning out their gutters. I know I have to do that every fall up here in Kansas City. They fall off the ladder, ambulance to the emergency room, hospitalized again for another 5 days. We're going to pay out another $2,100 worth of benefit. Now, in 1 year, they've been paid $4,200 worth of benefit. Divide that by your monthly premium, and you can see the value now. It's going to take your client over 11 years to pay more in premium than he or she would receive in benefit from having this plan and having these two benefit payouts. And then
the chances are likely within those next 10 years, they're going to end up going to the hospital again.
Exactly. Restores every 60 days and no lifetime maximum. So within that 10-year, we're talking about 1 year here. You know, if they're on this plan for 10 years, how many times are they going to be able to actually benefit from having this policy? Because as we get older, and you know this as I do, it's not a matter of if, it's a matter of when something eventually will happen. So hopefully everyone can see the value here and can explain that to your clients when you're sitting down with them. It's not a one and done. It's not a one per calendar year, every 60 days with no lifetime maximum. So two scenarios are going to happen to your client. They're going to get that invoice due immediately, or they're going to call you. You're going to help them file the claim, and we're going to get $2,100 sent back to the policyholder. So very, very easy to understand. And like we've talked about before, you know, the benefits can be paid out as little as $150 emergency room benefit, or what you're seeing in front of me here, a claim for $18,600. So again, just reiterating and honing in on the value here when you start to see some of these larger benefit payments get paid out. Now, we talked about the MAPD market and the rapid expansion that it's having. And a lot of it's due to the benefits and the strong networks of those MAPD plans, but it's also due to the growing Medicare population. You can see in 2019, there was about 54 million Medicare beneficiaries. By 2030, there will be over 80 million Medicare beneficiaries. So an increase of over 26 million Medicare beneficiaries that will be enrolling, that will be aging into Medicare. So a huge opportunity there. 10,000 people turning 65 a day from now until 2030. You know, we've been hearing that for a number of years. So if you're a new agent and you thought maybe you were a little late to the game, by any means, we still have 9 years of this exponential growth in this market for us to be able to help serve these policyholders.
And in 9 years, Nick, I will tell you, an agent can build a sizable book.
Oh my goodness.
You know, we got agents right now
9 years
at 400 policies a year in one book. And we tell agents now, with our increase that we got in our Medicare on our commissions, I will tell you, it takes around 350 clients to build a 6-figure renewal income in this Medicare Advantage market. So the ship has not sailed.
Yeah, I don't even think it'll take you 9 years to get there. You can probably do that in 5 years if you're proactive and be making that what we're all in this business for, the renewal income, mailbox money. You're making $100,000 a year because you busted your rear end for the first 5 years. I mean, that's incredible. And to your point there, they seem to be pushing these commissions up year after year.
We get raises.
Yeah, we're getting raises every year too.
Yeah.
So industry to be in than the one we're in, and especially with everything we've seen with COVID over the last year, our industry, I'm just grateful to be in this industry because it has been stable even throughout the pandemic. And I would say that our clients need us more now than they ever have with COVID.
I agree with you. I did a seminar and I do one maybe every quarter. And so I'll have these agents. All right, guys, everybody stand up. And agents have egos, man. You know that, right?
Yeah.
They're just like, oh, they're just a different personality. So all right, guys, everybody, if you're making more than 100,000, stand up. I'll get 3/4 of the room stand up. I'm like, all right, hey, way to go, guys. Y'all are doing awesome. Now tell me, how many of you guys are making the $100,000 in renewals? I would say 90% of them sit down. And the ones that are standing, I'm like, what are you doing to making that 100,000? And they're usually telling me they're selling Medicare.
Yep.
That's where it's coming from.
Exactly. And I hope that everyone can see this opportunity. And I'm sure that you do a great job positioning it. But we are in an unbelievable market at an unbelievable time. And Medicare Advantage plans, I'll show you on the next slide, over 50% of them are $0 premium. So you're enrolling a client into a plan that's costing them nothing per month and getting paid for it. It's almost like shooting fish in a barrel. I mean, when we take life agents and we show them the opportunity on the Medicare side, they can hardly believe it,
Right. And most of them are like, why haven't I been doing this?
I know, because they think it's more complicated than it is. And it's not complicated.
Yeah. And I think the other obstacle to this, or the barrier to entry, is they're so deathly afraid of AHIP.
Yeah.
I'm like, it's not that hard. I mean, it's not that easy either. But if you just spend a couple of days, you can knock that sucker out.
And once you've done it once, you kind of know what those questions are going to look like for the subsequent years. So once you've done it once, it gets easier after that.
Oh, yeah, I agree.
So this next slide here just shows the trajectory of growth of the MAPD market. The Congressional Budget Office projects that by 2029, over 40% of all Medicare beneficiaries will be on a Medicare Advantage plan, to show you, what kind of opportunity we're looking at. We're surpassing those numbers by now. It's going to be well over 50% by 2029, just to give you an idea of how much growth there is in the MAPD market. And like I mentioned earlier, in 2019, over 56% of those plans were $0 premium. So imagine this, you're taking a client who was on a group health plan paying $300 per month to a $0 premium Medicare Advantage plan. And do you think that they're going to have the $30, $40, or $50 to pay to add a hospital indemnity plan to give them better coverage? All day long, they're going to have
all day long. You just got to present it.
You just got to present it. Exactly. I mean, these guys were used to paying $300 a month. You're taking them to a $0 premium plan.
Don't leave money on the table.
No. And let's make sure we're protecting them, because like we said, things happen. You'll fall off the ladder, you'll slip on ice, whatever it may be. And then you're going to get that $1,500 bill in the mail. What if we could file a claim and you don't have to come out of pocket for it at all? That's what we're trying to accomplish here.
Beautiful.
So availability right here, you can see all the way from the West Coast to the East Coast. I'm in Missouri. You can see we're covered there in all the surrounding states. Texas covered in all the surrounding states there. So hopefully we are in your backyard and you can use our product. We'll go over the base plan pretty quickly here. But the base plan, it's like a cafeteria style product. You choose your base plan, then you could add any or all of the different riders that we have available. The base plan is going to be positioned around whatever that inpatient hospital copay is. So you can choose from $100 to $600 a day in $50 increments. You can choose any benefit period from 3 to 10 days, 15, 20, or 31. So if you've got an MAPD plan that's got a $350 per day copay for 7 days, you can match it exactly with our product. Maybe it's a $250 per day copay for 5 days. You can match it exactly with our product. So a ton of flexibility on the base plan to make sure we're covering the gap on that Medicare Advantage plan and protecting the clients from that inpatient hospital copay. We've also added observation benefits to the base plan there. So we'll pay 100% of whatever the confinement amount that they select above, up to 3 days per year for observation. And then we also have added the emergency room benefit in our base plan. That's the only other benefit added to our base plan at $150 per admission, up to 4 per calendar year. And again, that's not contingent on a hospital admission, which is really important to note. Some other companies out there require that the client actually be admitted to the hospital before they'll pay that benefit. And that's something that we do not do. So if they take an ambulance to the emergency room, stabilized, sent home, we're paying those 2 claims all day long, where our competitors are going to deny them because the client wasn't actually admitted to the hospital. And like we talked about earlier, it restores every 60 days with no lifetime maximum. So there can be a ton of value taken away from having this product here.
And since we're talking about benefits, man, talk real quickly about the claim process. How
Sure.
easy is it?
So the claim process is incredibly easy with Heartland National. We see what the other companies are doing out there, adding attending physician statements and paperwork on top of paperwork. We don't even have a claim form. All we need is the UB04 form from the hospital, which is their standard billing, insurance billing form. Write the policy number on it, mail it or fax it into our office, and that's all that we actually require in order to pay the claim. It's got the diagnosis codes and the procedure codes all outlined on that form. So just the UB04 form, and if you've been selling out any of the other products, you'll know that they take claim form, attending physician form, and try to make you jump through several hurdles before they pay that claim. And we don't do that by any means. It's an incredibly simple process for us.
Yep.
Other highlights: guaranteed issue between 64.5 and 65.5. So the base plan and all the riders outside of the lump sum cancer rider will fall into that guaranteed issue category. So a unique opportunity to take the plan out if your client's got health conditions where they may otherwise never be eligible for a product like this. We also offer issue ages 18 to 85. When we developed this product, we understood that there was a need in the younger demographic, whether it's ACA or high deductible plans. So we went down to issue age 18. You'll see a lot of those competitors are only going to 50 or 40, but certainly we recognize the need for this product, not only in the Medicare market, but the under 65 market as well. We have a very easy household discount of 7% that the client can qualify for in most of our states, as long as they live with someone 18 years or older and have resided with them for the past 12 months or live with their spouse, they're going to qualify for that 7% household discount. So it's incredibly easy to qualify for. Unisex rates, we do not discriminate tobacco versus non-tobacco. And again, it's an issue age rated product. So if you take at age 64, that's the rate you're going to pay for the life of the policy. The rates do not increase as the policyholder gets older. So another reason why, if your clients, maybe wanted to consider it, well, ma'am, if you take it out, if you wait, the premiums are going to increase down the road. So, let's go ahead and just make this decision today and get you covered because this will be the lowest rate that you can pay for that policy. We have a dual application available. So you can enroll a husband and wife or brother and sister on one application. There's a one-time $25 application fee, but if you're enrolling 2 people with one app, we don't require one from the husband and one from the wife. We'll just take that one-time $25 app fee. It is a simplified issue product again, so very easy to issue. As long as your client answers no to those health questions, we're going to process and issue the application or issue the policy. We do have a 6-month pre-existing condition clause, so do be aware of that. A lot of our competitors out there, you see a 12-month pre-X or even a 3-year pre-X or a 5-year pre-X. So 6 months shouldn't be anything to be overly concerned about. And then lastly, the different riders that we have available, and which you can see on our screen on our next slide here. One that's incredibly important to me is our lump sum cancer benefit rider. And it's incredibly important in the MAPD and the Medicare market. When I think of someone hitting a maximum out of pocket on a Medicare Advantage plan, I think diagnosis of cancer. So we need to be having this conversation with our clients. So we saw that $0 premium plan had a $4,500 maximum out of pocket. I may look at adding $10,000 worth of cancer coverage because Luis and I know that cancer treatment typically can span more than 1 year. And we also know that we're going to want to start high. And if they can't afford it, maybe we bring it down to $5,000 of cancer coverage. So at least we can protect them from that maximum out of pocket for the initial year of them being diagnosed with cancer. You can select anywhere from $1,000 to $20,000 worth of benefit. For the stage 0 cancer in situ, we'll pay 25% of the face amount. So if you had a $20,000 benefit, we pay $5,000 for that stage 0 cancer. And then for skin cancer, you hardly see any plans with any skin cancer benefits. We're going to pay 5% of the face amount for skin cancer. And one thing to note also is there's a built-in recurrence benefit with this rider here. We'll touch on it with the next slide. But if you've been paid out once, what it does is it gives the policy the ability to restore and protect your client later down the road if something were to happen to them again and they get diagnosed with cancer for a second time. The next rider, lump sum hospital confinement benefit rider, is a great rider to add to the younger market. It pays a lump sum in addition to that base plan there. So if you've got somebody with a $500 per day plan for 10 days and the $2,500 lump sum rider, they're hospitalized for 1 day, 24 hours. They're going to get $500 from the base plan, $2,500 from the rider, or a total benefit payment to them for $3,000, which can really certainly eat away at that deductible or that maximum out of pocket they may be exposed to. The next two riders really fit like a glove around your Medicare Advantage plans. Gives you the ability to cover the outpatient surgery copay by adding this rider to the plan from $100 to $1,000, and that'll pay twice per calendar year. We also have the skilled nursing facility benefit rider. I'd advise you all to take a look at that rider because when it comes to the monthly premium for it, it is incredibly marginal to what benefits could be actually paid out from having this rider to the plan. The client can select $150 per day or $200 per day. We've got a 20-day elimination period with this rider here because Medicare, there's no cost to the Medicare beneficiary for the first 20 days, but we'll pick up and pay days 21 through 100. And if they selected the $200 per day plan and maybe their copay is only $180, they can do whatever they want with that additional $20 per day because, again, it's an indemnity plan. We're going to pay the client exactly what they've enrolled into. And then again, touching on that recurrence benefit on our cancer rider there, this is really the sizzle that I want to make sure that your clients understand. You know, they've got $10,000 worth of cancer coverage. They're diagnosed. They send us the pathology report. We pay a check for $10,000 to your client. They go through treatment. They're in a period of remission, no longer having any signs of cancer. After 1 year being cancer-free, it's going to restore to 10%, 2 years, 25, 3 years, 50, 4 years, 75%, and after 5 years, it's going to restore to that full face amount of $10,000 again, which is incredibly important because statistics say that people that have been diagnosed once are more likely to be diagnosed again at some point in their lifetime. So this rider is incredibly important to make sure that your client understands. And guess what? It's at no additional premium. It's built into the rider cost.
Nick, real quick, before we go on, can you go back one slide? And I just want to tell our agents one thing. That brochure on the right side, guys, Nick, how much do they cost?
$0.
All you got to do, agents, is order them. When you're doing your presentation, and if you're wondering if it's compliant, the SOA has a scope of appointment, has a little box that they can initial in that will give you permission to talk about hospital indemnities. I always have all my seniors sign that. And then what I do is I have this brochure. In fact, I'm going to go place my order today for more. But this brochure needs to come out with every presentation that you do. Go ahead, Nick.
Yeah, if you just start adding this to your existing presentations, you are going to pick up sales. It is that simple.
Oh, yeah.
We'll show you tips at the end here how you can bring it up during your MAPD review. But I would just advise everybody to build it into your presentation. It's probably going to take you 5 to 10 minutes to talk about, and then another 5 to 10 minutes to enroll. So an extra 20 minutes of your time, you're going to be adding anywhere from $200 to $300 to $400 on top of the commission that we already talked about. That's incredibly generous at the agent level. $539 for the Medicare Advantage Plan for new to Medicare. And then adding a $200, $300, $400 on top of that, you're getting close to $1,000 in commission for just better protecting your clients. And if you're enrolling a husband and wife, well, heck, that's a heck of a day. And hopefully you got another appointment for a husband and wife. And man, you see why this opportunity, why so many people are jump into the Medicare space, because the opportunity is incredible.
Yeah, I agree.
The other riders, ambulance benefit rider, I see this added to almost every plan that comes across my desk. We do include air ambulance services. It's $200 per trip, 3 per calendar year. And again, not contingent on a hospital admission. It's very cheap to add that rider, about $2.40 if you're over 65 to do it. So I just go ahead and build that rider into your presentation of this product. We also offer the wellness benefit rider, which will pay a $25 benefit up to 4 times per year for any of those different wellness tests that you can see on my screen there. Colonoscopy, physical exam, mammogram, vision, hearing exam. If you have this rider, we'll pay you a $25 benefit up to 4. And when you do the math on it, your client's walking away with a little over $60 a year in just extra cash if they go ahead and file for all 4. The last rider that we have available is the dental vision hearing rider at either $1,000 or $1,500 per calendar year. There is a $100 deductible with this rider, but what I did not want to make subject to that deductible were those preventative services like the dental cleaning, vision exam, or hearing exam. So when you get your client enrolled, have them schedule that first dental cleaning 3 months out, and we'll pay them a $75 benefit, not subject to that deductible. The same goes with vision and hearing exams as well. We'll pay those benefits not subject to that deductible as long as you schedule it 3 months out.
Hey, Nick, on the benefits, is that per person and is it deductible per person?
So these are an individual plan. So it's all per person.
Okay.
So on our individual chassis, this is all per person.
If we write husband and wife, husband has his 1,000 or whatever benefit, and he'll have his own deductible to meet.
Exactly. They both have 2 separate buckets to use there. After 6 months, they'll have access to the basic services, fillings, root canal treatment. They can go out and purchase eyeglasses or contact lenses. They can purchase hearing aids or get any repairs done to their existing hearing aids or supplies for those. There is a $200 prescription eyewear or hearing aid maximum per calendar year. A lot of the plans that you see out there now, that restores every 2 years. So, if you had to get your hearing aids repaired this year and you use the 200, next year you can go out and purchase contact lenses or eyeglasses. It restores every year. And then after 12 months, you'll have your major services, bridges, crowns, dentures, and extractions. And you may be saying now, well, how much are you paying? Because I know you're not paying 100%. Well, we're paying 60% of actual charges year 1, 70% year 2, and years 3 and beyond, we're paying 80%. So again, 2 things stand out to me on this slide here is we're paying a percentage of actual charges. So whatever the provider bills, we're paying 60, 70, or 80% of it. Now, you may have been in this case before, and I believe you have, Luis, even personally. Well, you've got a plan, your provider bills you $100, and you're only getting 80% of $80 for some reason. Well, that's because most plans out there are reimbursing based off of the usual, customary, and reasonable schedule, the UCR schedule. So if 80% of the providers in your area are charging $80 for that service, but your doctor's charging $100, they're only going to reimburse you off of that $80. Right. Our plan reimburses you off of what the provider bills, so there's no confusion, no gray area there. And then
what I like also, and another thing to notice is on major stuff, most dental plans are at 50%.
Exactly. Year 3, you've got access to 80% of those major services. And those are the high dollar amount services. That's where we want that 80% of coverage. The most I've seen out there is 60%. So you're exactly right. Most are 50, and I've seen an occasional 60% out there, but no one's touching that 80% mark.
Right.
Now, I've got an example of commission on the board here. On what it can do for.
Now, let me tell you what here. As soon as you said commissions, I'm like, all right, you get the agents are like, all right, now they're getting close to the speaker.
Yes, exactly. I mean, this is what we're in it for. But again, at the end of the day, by educating our clients on this plan that can protect them, it's going to make sense, 2 out of 3 times, 2 out of 4 times to those clients. So they're going to see the value based off the way that you present it. And then just by doing them right, you're going to put more money back into your pocket, which we're all looking to do. So if you've got a 65-year-old 5-day plan, $350 per day, you add the ambulance rider, you can see the cost, the monthly cost for those, $31.50, $2.40. You're adding $10,000 worth of cancer coverage, $65.90. Subtract that household discount, you're going to be at $61.29. If you sell 2 of these a week, all I'm asking is 2 of these a week, you're going to increase your bottom line by over $40,000 annually. So when we talk about all the things that we have to worry about as agencies, agency owners and independent agents, how do we reduce our acquisition costs? We add more products. How do we pay for more leads? We add more products. So this is going to be able to give you more revenue into your business that you can spend to help grow your business. And again, all we're doing is adding value to the client, letting them make the decision, being an educator. And 2 per week, you're adding $40,000 to your bottom line annually. I know you've been selling 2 per day during AEP and many times more than that. So this is just a very bottom line baseline number that a lot of agents can reach.
You mentioned two benefits, and there's a third. We're training our agents when they build sizable books, they got to start hiring staff.
Yeah.
Hey, you want some money to pay some staff? Have them help you sell this if you're unable to sell it at the time of the appointment. Sometimes you're overbooked. Sometimes, they say a no, which I always tell agents, a no really just means not now.
Yeah.
Okay. And now you can have a licensed staff member, part of your organization, part of your team, sell this product for you. So again, this is another way to help grow your book, grow your staff.
Exactly. So we're going to touch on tips on how to present the product, but just different scenarios in which you could do so. Obviously, it makes 100% sense to bring this product up during your Medicare Advantage Plan enrollment. You're talking about the premium, whether it's $0 premium or a low monthly premium, and we're talking about the gaps in their coverage. Let's plant the seeds during that conversation to present the hospital indemnity plan to help fill those gaps and give your client more peace of mind. As Luis mentioned, maybe you are just out there crushing it on MAPD enrollments during AEP, and you don't have the time during AEP to add this product. I would say that I would almost argue against it, though, because it's literally a 5 to 10 minute conversation in a 5 to 10 minute add-on. But there's people they're just going to do it the way that they've always done it. So you can follow up to your MAPD sale, maybe during OEP, to present it. I feel like there's no better time than now when you're sitting with your clients. Even as Luis mentioned, maybe you've got someone on staff where you can plant the seed and then kick it over to that staff member, and they can actually do the enrollment for you while you go on to the next appointment. And again, it's paying for that staff member there. This one product that's just you're adding to your toolbox that's paying for that staff member that you're going to be able to use not only for these enrollments, for all different kinds of things, customer service, whatever it may be. It's a great product to help bring more income into your business. And then lastly, if you've got someone on a Medicare supplement plan, they can no longer afford those monthly premiums, and you're going to bring them to an MAPD plan. Well, to give them a little bit more light coverage, add the hospital indemnity plan. So here's 3 different opportunities for you to be able to position this product here. And before we go over to Luis, we'll talk about a presentation that's tried and true. My boss has been an independent insurance agent for 35 years, and he's been using this presentation since the early 2000s, and it just works. So you're sitting down with your client, you're reviewing their Medicare Advantage plan, their summary of benefits. You're going to stop on the hospital copay. You can see here it's $340 for days 1 through 5. Now you can turn back to your client and say, Mr. Jones, that means if you're hospitalized for 5 days, you're going to be responsible for $1,700. But Mr. Jones, don't worry about that, because I'm going to show you a plan at the end of our review here that can help fill this gap in your coverage. Just don't let me forget. You're going to continue your review. And again, you're stopping on the ambulance copay, $225, the emergency room copay of $90. But Mr. Jones, don't worry about that ambulance copay or that emergency room copay, because I'm going to show you why you won't have to worry about those charges. Just don't let me forget. So we're not doing anything different here, anything, guys and gals. We're just planting the seeds in that conversation. Continuing the review, you stop on outpatient surgery, $340 copay. But again, Mr. Jones, don't worry about that charge. I'm going to show you why you won't have to pay for that. You continue through the review. You're stopping on those out-of-pocket costs. You're pointing them out so they know that when something happens down the road, they're not going to call you and wring your neck because you didn't mention it. But fortunately for us, we've got a solution in place that we're going to talk about. So after we end the review and the enrollment, you're going to close up your booklet and ask your client, do you have any questions? Well, you've already pointed out over $2,000 worth of expenses that may happen to them in any given year. So they're going to turn back to you and say, well, how am I going to help cover all those different copays that you talked about? Well, Mr. Jones, back when I first started selling Medicare Advantage plans, I wasn't really sure how those benefits were going to be paid out. So after a number of years of watching our clients pay, quite a bit in out-of-pocket expenses when certain scenarios took place, we realized that we could help our clients offset those costs by adding another plan that we've got in our agent toolbox here. So let me ask you a couple of quick questions. Mr. Jones, have you ever been in an ambulance? Yes? No? Well, if you hadn't been in an ambulance, Mr. Jones, but you were in one, where would that ambulance take you? And 9 out of 10 times, they're going to say to the hospital, and you're going to say, well, more specifically, what part? And they're going to say the emergency room. So now, Mr. Jones, you've already triggered 2 co-payments on your Medicare Advantage plan, your ambulance copay and your emergency room copay. Now that they have you in the emergency room, one of two things is going to happen to you. They're going to stabilize you and send you home, or they're going to do what? And they're going to look back at you and say, well, they're going to admit me. That's right, Mr. Jones. They're going to admit you to the hospital, and that's going to trigger the most expensive part of your Medicare Advantage plan. That $340 per day copay for each day that you're in there, 5 days. So that's why we have this product in our agent toolbox, and you can bring out your brochure at that point and then bring up the quoting tool, because one thing that's great about this product, and you're going to demo this here in a minute, is our quoting tool is just so easy to use. You get the client involved. You can stay within a budget. You can address what's important to the client, tailor this product to that individual client. They're going to feel like you built it for them, because in reality you have, and they're going to keep this product on the books. Your persistency is going to be very strong with this product when you get them involved into the process. So Luis, I'll exit my screen here and let me take over screen sharing so we can run some illustrations in terms of the quoting tool.
Perfect. I'm going to show you how I've been doing it. I've been doing this a little over 20 years. The other thing, Nick, and let's just address this, the benefit, the per day, the hit plan is, and I give this example because I get hit from agents. I go in Monday night. I get released Tuesday morning. I didn't spend a full 24 hours there, but I was there for 2 days, Monday and Tuesday. How are benefits paid out, or what's considered a day?
Sure. It's a 24-hour stay. So you'll probably get the ambulance copay benefit and you'll get the emergency room copay benefit. But in order for that, $500 per day benefit or that lump sum confinement rider to kick in, it's got to be a 24-hour stay.
Gotcha. Perfect. Just wanted to clear that one up. Okay, guys. So here's what I do. This is my take here. So when I get out to my insurance, and we're going to go with a very rich HMO in my area, and I do something very similar. Okay. So as I'm doing my job and doing a compliant presentation, we are not supposed to write on these enrollment kits, but I will give my insured a pen. Hey, here's a pen. Here's what I want you to do. Nick, am I still on camera by any chance?
Yes, you are. You're good.
Okay, good. Okay. All right. Lost my deal here. Okay, no worries. So I will tell my insured, here you go. Here's a pen or a highlighter. And as I'm doing my presentation, here's my hospital copay. In our area in HMO, it's $100 a day for 7 days. Just put a star, highlight it, whatever it may be. I'll go down and I'll get down to the ambulance, $250, air or ground. Okay, and I'll do the ER 90. I'll continue my presentation and I will tell them, remind me at the end, to tell you how we're going to take care of it. Okay. I close my presentation. I write the policy up. I'm rocking and rolling, and then I'll kind of act a little dumb, which is not hard to do. Wasn't there something you were going to remind me? I'll kind of, there was something I was going to do for you. And no, Luis, you were going to remind me how I could save some money. Yes, that's right. Okay. Let's go straight to the portal. You guys are going to, once you're logged in, you're going to click right here on the Secure Flex e-app, and you're going to rock and roll. All right. So let's take the 65-year-old. Okay. 1, and I think it's 56 if I'm doing my math right. Where's my calculator? 2021 minus 65. 1956. Okay, I had it right. All right. So let's do my HMO. $100 a day. And you keep mentioning this, Nick. It fits like a glove. Here's how it fits like a glove. $100 a day, 7 days. Beautiful. I'm in Texas, and we'll assume this senior is married. I'm going to run the quote. Okay. I'm going to automatically going to add the $200 on the ambulance. Guys, $12. Incredible. Okay. Now, let's say I'm selling a PPO. Well, my PPO is $300 a day. So let's go run my PPO. Let's get back in here and change this 300 for 6. My rate's gone up to almost $30 a month. Okay, still extremely affordable. Okay, let's go back to my $100 because I do a lot of HMOs in my area. Okay, now I'll sit with my senior, and I've already got this $12 premium. And here's a pro tip: never start low and go high. Always go high and work your way down. So I automatically offer a $10,000 cancer. I built it in. Okay, and now although these plans are going to have, most plans for cancer is a 20% coinsurance. We have one carrier that does a copay for therapeutic radiation. So they're going to be out of pocket a chunk of change. Guys, when you have this lump sum cancer, it's writing a check out to them. Okay. It's an indemnity. They're going to make this money. They're going to have access to this money. How nice to have this as a cushion so that your spouse doesn't have to go back to work. And also, you're not going back to work. We're having a lot of seniors work way past 65 nowadays. And you know how nice it is to get a chunk of change to help out. Now, at this point, I'm at a little under $42 a month. Pretty easy. I haven't even added the other riders, but this is normally how I roll and how I do my presentations. Now, Nick, anything you want to add here?
No, I don't think so. I think you hit it right on the head there. I mean, just the flexibility of it. You know, your client may say, hey, you know, when you bring them, let them see your screen. So they can say, hey, what about that? What about that skilled nursing facility?
Yeah.
Right. You know, my mother was in a skilled nursing home and, you know, it nearly bankrupted the family farm. You know, what about that rider right there? Bring them involved into it so you can show them, you know, there's more riders there. And then with that said, they'll probably ask about it.
You know, here's the skilled rider, $184 a day after the 20 days. So let's go in here and adjust this to 200. Okay, not very much. So I build out my plan. And then I'm going to walk you guys through how easy it is to issue. Okay, apply now. Okay, so here are the questions. Okay, if you are within 6 months of your birthday of turning 65, you do not have to worry about answering these questions. Okay, now if you're not in that age category, then we're going to have to go through these questions. Most of my appointments are face-to-face. So what I do, because some of these words I can't even pronounce, I just turn my screen around and let my senior look at this. Just you tell me how to answer these. Now, Nick, what happens if they answer a yes to any of these questions?
It's a knockout. Since it is simplified issue, if they answer yes, it is a knockout.
Okay. So we're going to assume no. Now, because I am offering cancer, I am going to get these 2 additional questions. Again, if you answer yes, Nick, what happens?
Knockout on the cancer rider. You'll still be eligible for the base plan and the other riders.
Okay. So 5-year look back on the cancer, guys.
5-year look back on the cancer. Exactly.
Okay. So I will hit save and continue. All right. So let's go fill this out. Mail.
And it is this quick, guys and gals. I mean, Luis is going to probably run through this here in about 5 minutes. So when we talk about, you know, adding this and you may be thinking, well, you know, how long is it going to take to do it? Well, you're planting the seeds during your MAPD enrollment already. It's about a 2-minute transition after that. And then you'll see how quickly we can actually complete the EAP here.
So I'm going to plug in my info here. Okay. Let's go save and continue. Okay. Now, Nick, Medicaid, what do you see issues here with Medicaid?
Well, it's not a knockout for having this plan, but, you know, a lot of those programs out there have they're really looking at the client's bank accounts. So adding extra benefits that can go into those bank accounts, or if they're on a spend down plan, this could create some issues with Medicaid. And a lot of times those are just the clients that maybe not be ideal for this plan anyway, because the premiums are a little unaffordable for them.
Yeah, if premium is going to be a barrier. And then also you got to be careful. Most of these individuals with Medicaid will be going into a dual plan where everything is already at a 0. They don't have any medical cost. So you got to be careful about offering this to people that are on Medicare and Medicaid because it could affect them negatively. All right. And then what about replacing an issue here? Let's just say yes.
Not really. You just add the coverage that you the company you're replacing there.
Okay, perfect. So we're going to go with a no for simplicity's sake. We'll go next. All right. So on the household resident, Nick, pretty easy.
Very easy.
Okay, we'll say yes, and you'll put the name of the individual and the relationship.
I mean, it could be an adult child living in the home. That simple.
Gotcha. Let's go with no. We'll hit continue. All right, I'm going to have another chance to review the benefits here. Let's just say they come back and I'm like, you know what, Luis, this $60 premium is not in my budget. All right, well, let's, you know, what can we take away? I'm not going to mess with my base. Me personally, I'll probably get rid of the skilled nursing. Okay. Well, how about 44? Let's rock and roll. All right. We're rocking. Save and continue. Okay. Now, effective date. Nick, how far out can we go?
90 days, which is going to be great for AEP. You're going to start AEP, lining these with 1/1 effective dates. Perfect.
Perfect. Choose your effective date. You're going to choose your method of payment. We'll go monthly. Now on the draft dates, you got to be careful here, Nick. Hit me up here with the draft date.
So it defaults to draft immediately. So if you're flying through this and you leave it on there, once we process the policy and issue it, we're going to draft that initial premium right away. So if your client wasn't prepared for that, that could cause some upset stomachs. So you do have the ability, though, to draft the initial premium anywhere on or before the effective date. So if it's October 20th and you're enrolling for a 1/1 effective, you can actually set the first draft to come out on January 1st. So just be aware of your options there. And if they want to draft immediately, great. If they want to wait until the effective, they can do that, or anywhere on or before the effective date. So a lot of flexibility there. It's just really important that your client knows when to expect that first draft.
Gotcha. Oh, I thought I'd remember my Chase routing. Here we go. What is it here? Let me just copy 614. That's what it is. All right, so it does its thing. All right, here's the deal here. Okay, guys. So let's assume you go through this. You're going to hit certify. I want my policy to go to the insured or the applicant. Okay. Okay, I plug in my info. And guess what? I have a lot of agents that get stuck here. You're like, Luis, I'm hitting save and continue. I filled it out. Okay, guys, agents, you have to remember up at the top, you have to download and review these documents with the insured. So download the outline of coverage and download this guide. Once you've done that, then you can hit the save and continue. Okay, so did you meet with the applicant in person? Okay, no, I'd say I was doing it over the phone, or yes, they were here with me. Did I complete it over the phone? That's a no. Was any other person present? No. Did I review it? Yes. Did they review it? Yes. Am I related? No. Is it replacing? We'll go with a no. Have I sold anything else? I'll put a no. And we'll leave it at that. We'll hit save and continue. Again, pretty easy, guys. I certify, I go next.
And now, you're done.
I'm done. At this point, Docusign. Docusign is beautiful. Okay, if they're there in person, you can do it on an iPad, you can do it on a desktop, whatever it may be, they're going to sign with their finger. Okay, by email, just choose the email, and you've already entered their email at the beginning, so it's going to shoot them an email, and they can DocuSign remotely. Beautiful, easy tool to collect their signature. And at that point, submit.
And just to be clear, you can use this, you can enroll this product over the phone. So if someone says, they pass on it and they call you a week later, you can certainly enroll them over the phone. They'll just use DocuSign via email there.
Very doable, guys. And then wait for a couple of days for what to come in.
See that deposit.
Get that deposit in the check. Oh, I love my deposits. So guys, we got to throw it out there. I always tell the agents that I work with, you got a 50-50 shot. Just ask. You threw out a term that I'm going to steal from you, man. And I've never thought of it this way. But you talk about we're educators. Okay. All we've got to do is present. It is that easy.
Yeah, it's not a salesy pitch by any means. Here's the plan we're enrolling you into. Here are your exposures. Here's a product that can fill the gap. It's that simple. And a lot of clients, will see that it's that simple and say, you know what, that just makes a whole lot of sense. Let's go ahead and do that for $30 a month.
Yeah, and they will. You got to realize some of these clients, if they're leaving employer coverage, guys, they're paying some sizable premiums. We did this training earlier on an ACA under 65 health plan, and there's premiums they're going to pay. They're used to paying some premiums. Well, if I'm going to put them into an MAPD with no premium, why am I going to leave some money in the table? $30, it's very doable. You just got to present. So anything else you want to throw out at the agents? Any tips?
I don't think so. I think we hammered everything. It's just it's a market that's continuing to grow, and these products are going to grow with it. So just be sure that you're offering it so that other agents are coming into your clients' homes and doing that behind you. Just make sure they understand that here's your options that are available. It's not salesy. Let them make that educated decision, because again, at the end of the day, we're just educators trying to help our clients find the best plans that'll protect them from their healthcare, for their healthcare.
And I'm certainly not going to leave $40,000 on the table. No, heck no. Well, guys, I hope you learned something. Order the brochures, get your contracts, or get your contracts first, and then you can order brochures. If you don't have the ability to get your contracts, so if you don't know where to get them, guys, get a hold of me. We'll get you contracted. Nick, was it like a one-day turnaround for contracting?
24 to 48 hour turnaround. So, we're in this market where we see contracts go out to a carrier and it sits for a week, 2 weeks, 3 weeks. That's not happening here. You fill that contract out, we're going to get you turned around in 24 to 48 hours, 24 to 48 hours, and you're going to be right in the same week.
Yes. So hit me up if you need contracts. And other than that, guys, start selling this product. Our seniors need this product. So thank you.
Thank you.